.com.
It's time for the Russ Belville Show's Cannabis Q&A with Dr. Mitch Earleywine. Dr. Earleywine is a professor of psychology at the State University of New York at Albany and a leading author and researcher on cannabinoids and health, who pins the Ask Dr. Mitch column for High Times magazine. Get your questions ready in our live chat or call in to 971-533-7111 now.
Welcome back, everyone. Half past the hour on a Monday, and that means it's time to get your dose of medicine. It's Cannabis Q&A with Dr. Mitch Earleywine. Hello, Dr. Mitch.
Hello there.
Welcome back to the show, and starting things off, we want to remind everyone that you can get your questions in right now to our live chat room on Ustream, or you can dial the old-fashioned way on the telephone at 971-533-7111. We always like to open things up by giving Dr. Mitch the first word on the latest in cannabis science. So what's up, Dr. Mitch?
Literally today, the Journal of Affective Disorders published online a study called The Association Between Cannabis Use and Mood Disorders, a Longitudinal Study. And the bottom line is, guess what? There ain't one. The major depressive disorder is not linked to previous cannabis use. In the giant NESARC data, the National Epidemiological Survey on Alcohol and Related Conditions. So this is the government's own data, and these researchers took a close look across 3 different years. And sure enough, basically, smoking marijuana doesn't cause depression.
Good to hear about that. Now, I know when we look at the figures for schizophrenia or psychoses like this, one of the things we always point out is, you know, there was a huge rise in how many people used marijuana, but not an accompanying rise in how much schizophrenia or psychoses we saw. Is that how they figure this out with respect to the depressive disorders, that there just wasn't the expected increase, or is there other ways that they tease these numbers out?
It was curious because what they often do is go, cross-time marijuana to depression versus the size of the effect going cross-time from depression to marijuana use. And there was some of that sort of self-medicating baseline major depression leading to initiation of cannabis use later. It wasn't a huge effect. The odds ratio was 1.7. But there wasn't that same kind of thing going the other way. So it didn't look like cannabis was leading to depression.
All right. We've got a question from our chat room. Bob would like to know if you have any information on e-cigarettes / vapor pens and what, if any, carcinogenic actions they might have. I guess this could be asked about the tobacco ones and the cannabis ones.
It's interesting because the e-cig literature is really small, and we're still getting data coming in. But by design, they don't have a lot of the respiratory irritants and potential carcinogens that we saw in regular cigarettes from before. So everyone's anticipating that it's not going to be as carcinogenic or even as irritating to the pulmonary system. But we just don't have the data yet. It's funny because these are all over the internet, and lots of studies are out just saying sort of what they are and what they're used for, but we don't have any data on long-term effects simply because they're just so new.
And how about how they make these? I know that some of them are vegetable glycerin, some of them are propylene glycerin. Is there any difference in the glycerins they use and any health concerns we might have about them?
It's funny because, in fact, the amount of glycerin you'll actually end up ingesting is so small that a number of folks have told me it's probably not a big issue. But the key, again, is going to be, is it going to be an issue across time? And unfortunately, we don't even have 2-year follow-up data yet.
All right. We have a question from Speed Limit in the chat room who wants to know, following the election and the results in Alaska, Oregon, and D.C., what do you think the chances are the president and Congress will make a bipartisan effort to either reschedule or deschedule cannabis at the federal level?
Oh, I mean, I hate to sound negative, and I'm certainly open to the idea, but I don't feel like the contingencies are there for them. This isn't the kind of thing that's going to get them votes or get them money or somehow contribute to any of their legacies in the way they might want. And so I just don't see it happening. If if the recovery had been weaker, or if the tax dollars were more dreadfully needed, maybe they would have gotten sucked into that. But I'm afraid the federal folks are still frightened, and as individual states finally fall, and it's pretty obvious that the majority of states are behind it, then they'll probably make the big switch.
Yeah, and how about looking even further forward till 2016? Of course, there's a presidential election coming up. There's likely to be 4 or 5 states going for legalization at that time, and no incumbent in the White House. How much do you think the marijuana issue could sway the elections? Could perhaps Republicans get the clue and go for younger voters by being the pot-friendly party?
Well, we've seen this happen in local elections, and it really has helped. And presidential elections are particularly notorious for big turnouts, so it would be adaptive on their part. I think the key is that they have to explain their rationale in a way that doesn't make them look like they were flip-flopping or waffling from before. I feel like the way Sanjay Gupta was real candid about, hey, I changed my mind as I saw new data, and to make themselves look educable and informed that way, that would be the way to pitch it, and I think it's potentially likely.
We'd have to get this past the party that currently on climate change responds by saying, "Well, I'm not a scientist. I'm not a scientist." So we'll see.
And of course, I couldn't read science
if we tried. All right, let's go to another question in our chat room. Howdy, y'all. Notes that Veterans Day is tomorrow. Are there any studies on the use of cannabis to overcome or cope with post-traumatic stress?
I have to toot my own horn here, and that Jamie Bowles and I just published something in Journal of Psychoactive Drugs, just looking at people's expectancies, and curiously, the high arousal and some of the re-experiencing symptoms, which are some of the most aversive of all, seem to be what people think cannabis will help. Some of the other factors less so, but clearly we've got a lot of folks out there who think cannabis helps. And as more data come in, I'm hoping we can fund a randomized clinical trial like some of the ones that have been proposed so that people could really, really do this and take a good look, because this is a serious disorder and one that's not going to go away.
And there was that researcher, Dr. Sue Sisley, who did she get picked up by UNLV yet? Have we had an update on that story yet?
Unfortunately, they haven't ironed out all the details. It sounds like it's going to go through, and I'm cautiously optimistic about it, but it didn't sound like the regents of that university had actually signed on the dotted line. Yeah,
we wouldn't want to have studies of marijuana. It might mess up all the gambling going on.
Exactly.
Okay. All right. There's a study I wanted to get, and I don't know if this is just the media repeating an earlier study that already come out, or if there's a new study that's come out, but the Washington Post today says the brains of marijuana users are different, especially if they start young. The LA Times was more sensational, saying regular pot smokers have shrunken brains. So,
wow.
Is this new, or is it the same old study?
I mean, yeah, as we mentioned last week, there were some new data on this, but you end up having to really look hard in a whole lot of different places to try to find those differences. No two studies ever find a difference in exactly the same place, which makes me kind of worried that this is really just a statistical fluke. If you look at 100 different spots, you're bound to find one spot that's different. And I'm never seeing these data sets really taking into account the fact that they're running so many statistical tests. I do believe the data on changes in brain function, and we've talked about that before. We do see changes in brainwave patterns when you're performing complex tasks, but we're not seeing genuine deficits in the actual task performance. So it sounds like the brain is plastic enough to handle whatever it is that seems to be changing in cannabis-related ways. Now, these data on, heavy use early in life are pretty compelling. That ratio of gray to white matter doesn't seem to come out exactly the way it ought to, and it's rough on memory in the long term if you're hitting the pipe hard before age even 21. But I think this notion that marijuana is going to shrink your brain is particularly comical given the compelling data we have on alcohol shrinking everyone's brain, and nobody seeming to make the clarion call for that to be illegal again. Thank God.
Yeah. All right. We have another study that was quite interesting. This came out from the NYU Center for Drug Use and HIV Research. It was called An Examination of Opinions Toward Marijuana Policies Among High School Seniors in the United States, that discovered a third of high school seniors think marijuana ought to be legal. Another 28.5% believe marijuana should be treated as a minor violation, like decrim. And 10.4% of high school students said anybody should be able to purchase marijuana. They called this data from the Monitoring the Future study, but does this not portend a rapid change to marijuana politics as these people reach voting and legal age?
What's funny is, in fact, the way the Monitoring the Future study is conducted, I would suggest that these are actually underestimates of the true support for a legal tax and regulated market or decrim, because the students are filling these out oftentimes right there in the school and might be embarrassed to say so. So I do feel like that's going to go well. We've all seen those folks who, sat around the bong in college and were completely delighted and then suddenly had kids of their own and kind of freaked out and suddenly got all prohibitionist on us. But odds are high this is the generation where that's really going to not be a big issue, and we could see a lot of laws fall, a lot of prohibitions disappear when these folks reach voting age.
Now that we have 5 jurisdictions that have voted for legalized marijuana, and all 5 of them also have medical marijuana programs, how do you think there should be an evolution of medical marijuana alongside recreational? Should it be maintained in two separate schemes, or should they be integrated somehow? What are your thoughts?
It's funny because I'm really not a policy expert, and I have a lot of affection for folks who need medicine and don't want to be gouged as far as the prices are concerned, so I can understand that. But I'm curious if there might be a way to make it so that everybody can go to the same store and have the same products available, and then there's a slight decrease in price for folks who have some kind of medical approval, and that's just out of the kindness of our hearts and how we all know that it's a good deed to help cure the sick, but that it's not completely outrageously more expensive for the recreational users too. And I think in the initial laws, we were often trying to bend over backwards to try to make it worthwhile to everybody who was going to vote, and we may have kind of messed ourselves up in making such a wide disparity between the medical and the recreational markets, and essentially encouraged people to go make up some bogus medical condition or go find some physician who's not necessarily going to press hard on symptoms. And that's not what we want to see. We really do want to focus on taking care of other citizens who are sick, but still providing a good market in cannabis in part so that we don't get undercut by the underground market.